Hello, I'm Jo. I'm one of the team leaders. I'm a mental health nurse working in substance use. Okay, so lots of the people that we see are going to have mental health issues. It's pretty much the rule among this client group. Not all of them are going to want to discuss their mental health with us, and that's absolutely fine. We know that there are poorer health outcomes for people with mental health problems generally, so if anybody's coming to see us talk about any aspect of their health, that's brilliant. And the fact that we do have a lot of time means that we can really do the sort of making every contact count, have opportunities for health promotion if people are up for that. We've got a lot of people have sort of unaddressed inaccurate health beliefs, and we can really sort of unpick that and support them to access year-round services. So we can do a lot of really valuable stuff in terms of health promotion. All the senior volunteers in the centres have got some mental health awareness training. We've also got guest welfare. We've got the Samaritans in all the centres. So there's lots of support for the guests around sort of holistic mental health. We've also got people doing complementary therapies and lots of activities and things as well. So there's plenty of stuff to refer people into. In terms of the support you've got within your teams, every healthcare team will have at least probably a mental health nurse or a psychiatrist or GP with special interest in mental health. We do encourage team working. Guests may actually just get on with you, appreciate that, just need to be listened to, and you're doing a great job of that, so not necessarily going to need to see the mental health professional. A lot of guests will actually be in touch with their local mental health teams or have some support networks. They might be moved further away from them because it's Christmas, or the people who normally support them might be off, but we can just support them to re-engage with that after Christmas and look at sort of holding and supporting until that time, maybe just making a bit of a plan as to how they're going to manage things until they're able to get back in touch with their local mental health team. At the other end of the spectrum, we might have guests whose mental health needs seem to be very urgent. Our options then are A&E, mental health liaison, or the local crisis mental health teams. Sometimes it can be helpful to write a letter to, if a guest maybe has difficulty in expressing themselves to their GP, sometimes we might offer to write a letter for them, just explaining where they're at and what they feel they might need in terms of support. If that's the case, we always give the letters to the guests so that they're in control of that. We don't sort of write directly to anybody's GP or anybody else. Sometimes we come across guests who might not be linked in with GP services and who maybe need some year-round mental health support. So then we'd be looking at speaking to guest welfare about supporting that guest in terms of registering with a GP. We can sort of give people information about their rights to GP registration. We do have those groundswell cards which we can give to people, just explaining that, they don't need ID, and that they have the right to be registered with a GP despite being homeless. The first thing we do is kind of try and focus on their strengths and their resilience. People have been coping with quite a bit of adversity, obviously, and often because people have been moved into a new environment for the week, their normal coping strategies or the way that they might implement them may not be available to them. So it can be really useful just to talk to people about, well, how would you normally cope? What do you normally do when things get on top of you? And it might just be that they need a little bit of adjustment to be able to do that. Lots of people maybe cope by something like going for a walk or going and sitting in a quiet place in which they feel safe. If they're away from that usual place, it can be about sort of problem solving. What would that look like for you? Or is there anywhere that you want to sit quietly, either in the centre or is the park across the road, things like that. Also looking at, there's a lot of activities on offer which can map to people's strengths. People might be really good at karaoke or art or whatever they want to do. So encouraging them to work to their strengths and do something that makes them feel good can make a big difference. Often alongside sort of the disruption of being in a different environment for the week, people quite often have lost or discontinued or run out of their medication and found that the place where they'd normally get that from is not open. Now, we don't do repeat prescriptions, but what we've got pharmacists on the team who are absolutely great at sort of problem solving ways of getting the guest access to medication that they need in a timely manner, and also really good at just advising, can this wait? Often people will come and see us when they're experiencing some level of withdrawal from substances. Okay, it's quite helpful if we explain at an early stage we don't have any psychoactive meds. People who are coming to us looking for some sort of substitute then can either, be supported to go to their normal drug service, or at least their expectations are managed. So then they can still come to see us. We can talk about symptomatic relief. We can give them harm reduction advice, and we can signpost them to their local drug and alcohol team. Just a very, very brief overview of what we do in terms of when people are withdrawing. So opioids, we look at symptomatic relief. Pharmacists, again, are really good at advising on that. It is, simple analgesia, loperamide, that kind of thing. We also would be looking to do quite a bit of harm reduction advice with the clients. Obviously, they're in a different environment. If they're in withdrawal, they're at higher risk of using in a more risky way. We know that just using in an unfamiliar environment can increase the risk of overdose, so we'd be looking to give that sort of information and encourage them to do their harm reduction, use smaller amounts, don't use alone. We also encourage people we'd like to give people information about the availability of naloxone from local drug and alcohol services and encourage them to make contact with their local team. You see, there are drugs that we really don't want people to stop suddenly. So alcohol, GBL, we've seen a bit of over the last few years. Benzos as well, and that's so we have to give people advice to stabilise. With alcohol, we'd be looking at assessing the alcohol-related harm. We do have a lot of thiamine, and that can be quite a nice thing to just discuss with people why thiamine is useful if they're drinking at harmful levels. Also, most of our guests are not eating fantastically, so it's quite a nice sort of self-care thing that they can do for themselves to start taking some thiamine. And it's also a good reason to start thinking about engaging with local services and seeking some help from year-round services. We have seen a few people with GBL dependence or GHB dependence over the last couple of years. GBL withdrawal is very dangerous. So we do need to be clear that people are not. We don't want people withdrawing in the centres. Again, it's about encouraging stabilisation. Obviously, you've got cross-tolerance with benzos and alcohol. So we do see people kind of run out of GBL and manage with switching to benzos or switching to alcohol. Obviously, we don't have, this is about harm reduction, asking the client what they're doing. If someone's really out of everything, then need to be monitoring them quite closely and thinking about A&E as or getting them to a GP or drug and alcohol service on working days. So drug and alcohol services are open on working days. They usually will have at least some open access drop-in time where clients can just drop in and self-refer. So it's worth just finding the local drug and alcohol service if a client's very, very motivated to make some changes, and once that, we can speak to the shift leaders about arranging lifts or helping somebody to get there. And yeah, sometimes it can be just about sort of explaining what kind of things on offer. It doesn't mean people have to give anything up. It's about engagement and having a space to think about what they want to do next. Depending on the person's living situation, it can be helpful just find out where the guest's staying, have they got an address they can use, or, you know, the other thing we've got in the centres is we've got access to chain, so we can check that the guest's on chain and what borough they're linked to, and that just saves them sort of going to a service that they don't have a right to access and getting turned away. It's always, working with the healthcare team, I find you always learn loads. It's really good for reflective practice. It's an amazing opportunity to work with a whole lot of people from different disciplines, and it's absolutely great with the guests as well. I mean, yeah, my experience as somebody who works with, in my day job, with a lot of clients with complex needs, is that getting people's needs met in different services and the complexity of referral can be really quite frustrating and quite difficult for clients who struggle with that. Obviously we can't take that away, but just sometimes being able to see a client and speak to a specialist doctor or or a nurse who's worked in a particular area, get pharmacy advice straight away, just means it's true MDT working. The clients get a great deal out of that. They might sit down and talk to a pharmacist about what's going on with their medication, then be able to see a doctor and get a dressing done all in half an hour. And yeah, from our point of view, I've never come away from Crisis not learning a lot, and not being inspired.